Good day, friends. Today I want to introduce you to a lady who has been involved in the, what do you say, prison services?
The criminal justice
The
system.
criminal justice system of the United States. How many years you would say that you've been involved in this?
A total of 14 years.
A total of 14 years she's been involved in the criminal
Justice system.
justice system. And the value of this interview would be actually to let the public know what takes place in some of the lives of those in the prison system, but particularly people behind bars, you would say. Is that a correct term to use?
The focus is on people who have been arrested for any kind of drugs or alcohol. That's the population of focus that I work with.
Okay, now, so I'm going to let you get the real story because I'm rambling on like a real novice in this business. So I'm going to turn you over to Paulette.
Correct.
Okay, so here's Paulette now, and she will give you an idea of her work as regards the criminal justice system. So Paulette, you're on.
Okay, I'll take it from here. I'm employed by the 11th Judicial Circuit of Miami-Dade County. I work with Miami-Dade Adult Drug Court. And before I started working here, I had no idea that we had that kind of a service. So I'll give you a little bit of the history. What happened was back in the 80s, there was a crack epidemic. And the justice system realized, our leaders here realized that the way we were approaching treating people who have use drugs or sell drugs was not working because we were criminalizing drug offenders. And this is really a disease like anything else, like cancer or like diabetes. People who have severe substance use disorders, this is a disease. So our justice leaders here in Miami decided to form the first drug court in the nation. And that was Janet Reno and our public defender and the prosecutors and our Judge Goldstein. And I became, when I started working 14 years ago, I joined the first drug court in the nation, but our history dates back before I started there. So I started there in 2009, but the actual court was formed in 1989. And since then, we have had a whole lot of drug courts being formed after that. But I have the honor of serving in the first drug court in the United States of America. And I was employed first as the evaluator, where I evaluated, we refer to them as clients or participants who are arrested with, it could be possession of heroin, alcohol, any drug that you can think of, as long as they're arrested and for possession of a drug or drug-related crimes. They are eligible for drug court, and they can come into our court, and in exchange for doing treatment could last anywhere from a year to 18 months, and more severe cases will last even longer. And once they finish successfully, we drop the charges, and this allows them to have a second chance. So it's very rewarding work that I do. And so my first position was as the evaluator, assessing, determining if somebody has trauma, or if they need parenting classes, they need trauma therapy, they need individual sessions, group sessions. We make a determination of what they need, and they're sent to different treatment providers who provide this service. And now for the past 5 years, I've been working as the manager of Miami-Dade Adult Drug Court, and there I have a little more, how would you say as the manager, I'm able to influence the the direction of the court a little more, so to speak, in the sense that we can get grants because we need funding to provide all these services, and I can assess, I can look at the data and see what we need. And of course, I have to get internal approval, of course, but I can identify. For example, I just wrote a grant for people who have stimulant use disorders, and stimulants would be anything like cocaine, methamphetamine, and any ecstasy, because we find that in Miami we see more of that than any other substance stimulant. So I just wrote a grant and I'm waiting to see if it's going to be approved. We'll know in August, and if it is approved, we'll be able to treat people with stimulant use disorders, because we have them coming into the court now, and we feel as if we're not really providing all the services that they need. So we're going to use what's called a matrix model to treat these people with stimulant use disorders. We're also going to have what's called all of these services are going to be free, because if it's approved by the grant, it's covered through the what they call the Bureau of Justice Association. They're the ones that will be funding this grant, and it would be able to really direct the treatment in a much better direction for these people, for people who have stimulant use disorders. And we see really amazing stuff. We have a graduation every month, and we see people who come in. You never know who's going to make it and who's not going to make it. With all of our training and whatever, there's that X factor that makes some people, that all the odds are against them. They have had history of sexual abuse, history of physical abuse, all kind of stuff, severe substance use disorders. And some people respond, and with time, what we call recovery, enter into recovery, and really come back to be really, good citizens that we would want, citizens that contribute to society. And I was recently we have an annual conference every year, and I was recently there, and we had it in Houston this year, and it was so inspiring to see all the different people there. They brought in there's somebody there who was in jail for was sentenced to 35 years for trafficking marijuana. He was attempting to get 1,000 pounds of marijuana at the time, and he was sentenced to 35 years. And at the time that he was sentenced to 35 years, right around his arrest, he found out that his ex-girlfriend was pregnant with his daughter, and he just saw that he was going to repeat the cycle. He never had a dad in his life, and he didn't want that to happen to him. So what he did was, this is an interesting story, because what he did was he attempted to break out of prison 2 separate times, and so thinking that he's going to lead a fugitive life, but at least he would be in his daughter's life. So each time he's caught, and the charges, the sentence, that he's sentenced to more time in jail. And the third time he attempted to break out of prison, he was successful, but then the person that assisted him, this woman that assisted him, turned him in when she got pressured by the police. So 3 attempts to escape, because he wanted to be with his daughter and didn't want to repeat the cycle. And after the 3rd attempt, he got so much attention internationally, because it was all over the media and all this it was a lot of effort to break out of jail, and he started getting this media attention saying, he's smart, and he's saying, oh, so I'm smart? Nobody's ever told me I'm smart. So if I'm smart, I'm gonna fire my attorney, read up on law, and defend myself and get out of jail. And he did just that. It's one of the only cases that I know of that somebody defended themselves, a prisoner defended themselves, got out of jail, and he was at our conference. He came out in 2020. He shaved off the judge reduced 19 years off his sentence. So he came out 16 years and 9 months after being in jail, solitary confinement. During that time, he wrote his book because, after all that media attention and they're trying to get a movie on his life and everything. And at first he was resistant and, wanted to keep everything private because he's an introvert. And he describes himself as a quiet introvert. And then he decided, let me tell other people about my story and let me go out there and form a foundation and try to help people before young men, young males really, before they get to the point where I got to. Because at the time that he got caught, he was thinking, this is my last time I'm going to traffic drugs. He had paid down on a real estate course and everything, and he just knew this is not the life he wanted. And he ended up writing a book called Chasing Freedom, and he spells freedom as D-U-M, meaning he was chasing freedom in a dumb way because he was trying to be physically free, but he was mentally enslaved. So what he did, he wrote the book to explain how he's going to go out and talk to people, be a motivational speaker, form a foundation, reach young males from an early age and teach them how to get mental freedom, to learn how to fit into society despite what circumstances you're born into, and overcome the odds the way he did. So when he came out of jail, he got custody of his 15-year-old daughter. He said that was the hardest challenge he's ever faced, actually trying to bond with a 15-year-old his daughter. That was a very difficult task, but we saw pictures of them, and he now has a book out called Chasing Freedom. He has a movie coming out. He's a motivational speaker. He works for a foundation called I Can, meaning, we can overcome a lot of odds. And I see that in my day-to-day work, where people overcome a lot of odds. There's so much stigma against substance use disorders, and we treat it like a moral failing, but even though it has moral implications, and addiction really messes up the reward circuitry in our brain and will make a person go after stuff, steal from their grandmother, steal to get the drug, because it feels like their whole life depends on it, because the reward circuit in the brain is messed up, and they feel certain highs that human beings are not supposed to feel. And we call it euphoria with the use of certain drugs, and then they crash, and then they're constantly seeking that high, and it's trapped. And then we're here as a court, Miami-Dade Adult Drug Court, where we see mainly young males between the ages of 18 to 25, and it's just, we see parents come in and they're crying, and they'll say, like this particular, my son, he was like the star, this perfect child, and from 18 he started using, and it's been just downhill. Can you help us? What can we do? And then, we don't always succeed with everybody. I would be lying if I told you that we did, because addiction is a hard thing to overcome, but we have a lot of success. Our graduation rate is about in the high 60s, close to 70. Our recidivism rate, what recidivism means is that we track them 3 years after they're discharged to see if they pick up any charges at all. And we have our recidivism rate somewhere between under 10 to 13% of people that graduate get rearrested in the first 3 years after graduation. And we're working on, just coming back from the conference, so I'm all, motivated to make some more changes, to make sure we can reach a wider audience, that we can implement stuff that's science-based, and that we're following best practices and making sure we're doing no harm and not just doing what feels good for us. So I have quite a few challenges set out for this year, that stuff that I'm going to be working on, and changes that I'm going to be making. We're going to try to form what's called an alumni association, because we feel that when people graduate and they don't have they need to have a support system. Some people will go to NA and AA meetings, which are called 12-step groups, and they have that support. So they need that support when they leave us and they no longer have us in their lives, because when they're with us, we're testing them 2 to 3 times a week, making sure they're not coming up using drugs. And once we feel that that abstinence is now, they've been in the program, say, 3 months, and abstinence is now what we call a proximal goal. You're now able to, you're clinically stable, and you're now able to be abstinent. We have sanctions. We have, you can do community service. You could write an essay, and the sanctions are graduated up to a jail sanction, up to 5 days in jail. If you're caught lying, or trying to substitute urine, trying to beat a drug test. We have incentives that we give when people do well, like gift cards, we applause, a handshake from the judge, different kind of stuff like that. And incentives create more longer lasting neural changes than sanctions do. So we want to make sure that we have the same ratio of incentives to sanctions in our treatment court. So that's I think I covered everything.
I am
in a
very
nutshell.
impressed, and it must be very satisfying to see folks who have been really down due to drug abuse, and they're getting a second chance to be reformed and to fit back into society. I think that's a marvelous undertaking, and there's nothing much I could really add to this, but I am truly impressed at the system that is being operated. And you must feel a personal satisfaction in seeing things.
Yes, it's nice to find a job that aligns with your purpose in life. My purpose in life is to help others, and I get paid for it.
That's good.
And I get to see, not much pay though, when you work for the county, it's not a lot of money. But it's good to want to get up every day and to make a difference in the lives of these young people. And it's so rewarding to see it. We have I forgot to mention, we have case managers, and we have a whole staff there that's there to support them, peer support, peer counselors, people who have been through before, to help them. So it's really amazing work. It can be heart-wrenching at times. We've had overdoses. We've had not very frequently, but we did have somebody die from a heroin overdose, because your tolerance is down. When you stop using drugs, you can't go back and use the same quantity. So that's why there are medications out there now that can help mainly people with alcohol use disorder and opioid use disorder, to help them with cravings, because cravings never quite go away. That's the one symptom you can still continue to have.
Cravings.
Even when you've been in recovery for a while.
Okay.
Even we consider long-term recovery when you haven't used 5 years or more. That's stable recovery. Anything before that is early recovery, and you can still continue to have dreams or cravings. And if you go back and try to use the same amount that you used to use, you'll probably, if it's an opioid, you can suppress your respiration and overdose and die. And we did have one case last year, and it's very distressing to us when that happens. And just, we go to the funeral, you see the family, and it's just, it's really hard. But I'm glad to say we don't have a whole lot of that, but we have had it. So it is a difficult field to be in, but very rewarding, very rewarding.
Tell me about the family's reaction to what you all are doing. I mean, you sound close to this rehab sort of session.
Right.
But how does the family feel? I mean, how do they show their gratitude?
We have family therapy. As long as the family is amenable to family therapy, most people will get family therapy once they're stabilized and the family is amenable. Because sometimes the family is so broken that that's not a good option. But as long as it's an option that is therapeutic, we have family therapy. We have family coming to, we have what's called status hearings, where you have to come and see the judge. The participants have to come in and see the judge twice a month in the early stages, and as they get better and stabilize, it becomes once a month, once every 6 weeks, and family members come with them. And the judge speaks to them to find out. Case managers will talk to the family as long as we get a consent, and release of information, and we're authorized to speak with them. We will talk with them. We try to involve the family, because you can't get better by yourself. If when somebody gets sick, which what we call it, with substance use, they have a substance use disorder, the family sometimes gets sick with you, because there's just it has moral implications. There's so much stuff that can happen, so the family has to get well with you. And it's just so amazing at graduation ceremonies to see the family and how happy they are, just beaming and standing and saying, "I'm so proud of my child that they did it." And some of them back. Some we just two graduations ago, one guy started back his business after he had stopped using, because you get to real lows when you're using like that, because all you can think about is just having your next drug of use. So once they have enough support and the treatment is there and they stabilize, and of course we keep them accountable by drug testing them randomly and regularly. It's just so amazing to watch the transformation and the gratitude from the family. That was a long answer to that question.
No, that was good. That was very good. You mentioned something there, and I wondered how it works. You talk about a handshake from the judge. Have you ever witnessed this actual exchange?
Yeah.
A handshake from the judge?
Yeah, and the judge praising them. They'll tell you, we've been messing up for so long. Nobody has praised us for a long time. And to have a courtroom applauding us when we've been abstinent, or you've shown up for your group or your individual session, and the whole courtroom applauding, or the judge saying great, and the judge spending 3 minutes with you and talking to you. And we have an amazing judge, by the way. Amazing. She connects with the participants, and they will tell you that they're so sick of themselves that they'll start doing it just because of the rapport they've built with the case manager, or the rapport they have with the judge. And they want to do it for us, and we'll tell them, no, you got to do it for you too, because we're not going to be in the picture all the time,
Very good. So very good. Very good.
It's amazing work.
Well, I cannot speak too much about the penal system back home in Trinidad, but I am sure that something similar might be, in the making or undertaken right now. But it's gratifying to know that a person on drug abuse, substance abuse, could get this help. Especially, as you mentioned about the man writing this book and chasing freedom. I think that's wonderful. That's wonderful encouragement. So, Paulette, I want to thank you very much for being very helpful and opening. You have opened up, a new vista to this matter of recovery from drug substance, and we really appreciate that. And
thank you. And I just want to add one thing.
You add as many as you like.
To anybody out there who may have a child, a cousin, a nephew, or anybody with substance use disorder, remember, severe substance use, moderate to severe. I'm not talking about those that are abusing drugs, but people who have a moderate to severe substance use disorder. They have no control over once they start using, they have a hard time stopping, and they drink to excessive. Remember that there's treatment out there. Reach out. Don't be alone. Reach out and try to get your child, your nephew, your niece, whoever it may be, the help that they need, because they can really find a true recovery. We have seen it so many times. Thank you.
Thank you very much. All the best to Paulette and the system here in the United States. And until the next session. Thank you very much.